Welcome back to the Morning Blend, everybody. There is a growing concern about substance abuse and mental health issues with COVID-19. Experts say social isolation and loneliness can create problems with drugs and alcohol and make mental health problems worse, too. Kelly Kitley is a psychotherapist. She joins us with more on ways to manage this tough time. Hey, Kelly.
Hi, Molly. So good to talk to you this morning.
Good to talk to you too, and thank you for bringing this topic to our attention. You know, it's funny because I see things on social media and even amongst friends, we kind of joke about quarantinis and how there's so much more, wine drinking and that alcohol sales are up and those kinds of things. And while an occasional drink can be okay and some people can handle it, you're still concerned about substance abuse right now.
Absolutely. And, look, I think a lot of people are trying to manage and cope the best that they can. So I think it's important to remove the shame element for anybody who is drinking more and to just be mindful and aware. A lot of times alcohol can work as an immediate reaction to kind of take the edge off, but it's a depressant. And so it can interfere with sleep and mood and motivation. And especially as we continue to be in shelter, a lot of times people aren't thinking about, weeks to come and what that's going to look like. So being really mindful of how much you're drinking, just as much as you would about how you're moving your body or what you're eating, it's really important.
I think it's nice that you talk about not feeling shame about it, because a lot of people are getting up with their coffee and going to bed with their glass of wine or whatever their drink of choice is. It sort of makes sense right now because people sort of want to escape. They're anxious. They're worried.
It's normalized. And with the memes and the social media, I think it's giving people permission to overconsume. And yes, alcohol sales are up 55%. And it's important for people who do have a history of anxiety or depression or may have struggled with their drinking in the past. As a woman in long-term recovery, it's still something that crosses my mind. Gosh, it would be so easy to just check out and to numb a little bit. But for me, it's not worth it. And luckily, I do have a lot of great support systems in place right now to help me get through this time.
I appreciate that you just shared that too, Kelly. I know it's in your book too, but I think you've done a lot for people in reducing the stigma and probably in helping your patients too who struggle with it, that you share your own story. And as a mom of 4 kids, I think moms especially and people who are under a lot of stress, people drink because of stress. Sometimes they drink for boredom, but it's definitely happening now that people are in isolation. Let's talk about your concerns about mental health issues too, because the Mental Health America reported 5,000 new cases in the country. It's probably a lot more than that, correct?
Absolutely. And those are only the ones that are reported. There are so many people who don't even know necessarily that they're struggling and may think that this is just, I hear this from a lot of my clients. Everybody's going through this. Don't we all feel this way? And that's really not helpful. We have to look at it on a case-by-case basis. And isolation is one of the biggest fire starters for any kind of anxiety or depressive disorder, and not being able to connect with people emotionally and socially. And really, when we can get outside of ourselves, that's what helps us. So I'm encouraging people to reach out, to connect with other people who might be feeling alone. There's so many ways to get involved online with different types of groups, whether it's moms who are educating their kids from home, or dads, or people who are working as well as trying to help their kids e-learn. So it's really about reaching out. We have to take initiative.
I know you offer teletherapy sessions. You're helping people reduce anxiety, helping with mood, things like PTSD. And I think about, as we all struggle, there are also people on the front lines, our healthcare workers, our first responders who are dealing with even more than we are in terms of what's happening now with this virus. Do you think that when people connect virtually, that they're still getting the benefits of meeting with a therapist?
Absolutely. And it is different. It doesn't feel necessarily the same, even for me as a practicing clinician. So much of the relationship is about what goes on in that room, but being able to have alternatives rather than cutting it out completely is so important. And anybody who's struggling right now, and you don't have to classify as having a specific diagnosis, but if you're struggling, we want to be preventative as well and not wait until we come out of this and have to do all of this work on the back end. You know, being able to reach out, a lot of therapists are seeing clients for the first time, starting that initial contact via teletherapy. And I know a lot of my colleagues have actually worked in different states to try to get teletherapy approved until the end of May through insurance providers.
And I know so many people who talk about anxiety. Carson Daly, in fact, who's been very public about it, will mention that talking about it helps so much, and it's a great first step. I also want you to talk, you talked about being preventative. You have recommendations for your clients that I think are fantastic. It's focusing on daily living skills, but then also doing some things that we should be very aware of, like getting fresh air. I know you're also a fan of meditation, journaling perhaps. Talk to some of those things that we can be doing at home, on our own, with our families to help take care of ourselves right now.
They're really non-negotiables. You know, if we can write down, I even have something next to my bed as a reminder, do these 5 things on a daily basis. These are non-negotiables for you to make sure that you are showing up as the best mom, the best wife, the best clinician that I can be. That doesn't mean that, I might hit all 5 of those and still struggle. For sure, this is a roller coaster ride, but at least having something that is concrete, that I have evidence that in the past has really helped me, and I know has helped many of my clients as well.
And it's guided meditation. A lot of these things are free right now, yoga and other workout videos. Thank you so much for joining us. And I appreciate what you say in your notes about not putting too much pressure on ourselves and being gentle, knowing that we're doing the best that we can.
Please, sometimes we can be our worst enemy, and that doesn't help us at all.
I agree with you. Thank you so much for joining us, Kelly. We really appreciate it.
Thank you, Molly. Be well.
Yeah, you too. Great talking to you. And you can check out more of Kelly's suggestions, find out more about her. Go to our website, themorningblend.com, to find out more about Kelly and her practice too.